Your back is hurting, your knees give you that sound, and you desperately want to fix your forward head posture, but twisting and bending do not seem to do the job. You are not addressing the right place. To find the best way to deal with these pains, let us look at how your body is actually connected. We usually talk about the back, the knee, and posture as separate things, but they are all tied together through the spine and the hips. The spine does not just connect your neck and head to your torso. It also links directly to your pelvis and your hips. When the hips are tight or restricted, that creates a ripple effect. It starts at the pelvis, pulls the lower back out of position, and changes how the knees absorb force with every step you take. When the hips are not moving properly, the pelvis tilts forward or shifts sideways. That tilt adds pressure on the lower back and forces the knees to carry more load than they were designed to handle. There are many ways to deal with back pain, knee pain, and forward head posture. You can use painkillers, see a therapist for massage, or work on your core, glutes, or legs. We are recommending starting with hip flexor exercises instead, and here is why. The hip is a high-leverage joint sitting between the spine and the legs. Changing how it moves can quickly affect how your back and knees feel. Hip flexor work also gives fast feedback. You can usually feel a release in the front of the hip and sometimes the lower back within seconds. And even if tight hip flexors are not the root cause, loosening them can unblock other improvements in posture, walking, and movement. Here are 3 exercises to try. The first is the half-kneeling hip flexor stretch. 1 knee down, 1 foot forward, tall posture, gently shift the hips forward until you feel a stretch in the front of the hip and thigh. Keep the back straight and do not overarch. The second is supine hip flexor activation. Lie on your back, 1 knee pulled gently toward your chest, the other leg long and pressing into the floor. This teaches you how hip flexor tension affects the pelvis and lower back. The third is the seated straight leg raise. Sit on the floor or the end of a chair, 1 leg bent, the other leg straight, and gently lift the straight leg a few inches. This keeps the hip flexors active without deep stretching or loading. Do these once or twice a day and notice how your back, knees, and posture respond over the next few days. If you have been stretching your back or chasing knee relief without results, start by checking your hips. Sometimes the answer is not where the pain shows up, it is where the movement starts. Hip flexor exercises can reduce stress on the lower back, improve lower body mechanics, and support better posture, and they take less than 5 minutes a day to feel the difference. Train smarter, not harder. Thanks for watching.